Okay, so thank you for joining us for another Home Health Success Academy video. Let's go ahead and talk about rejections. Look, not everyone is going to start giving you referrals automatically. Not everyone, the moment that you walk in and you meet with a referral source, whether he's a physician or whether he's a social worker or a discharge planner, you are not always going to get that referral. And most of the time, not in the first time, not in the second, not in the third. We have actually mentioned several times in our video series that for you to be able to really get a yes, you will get an estimated of 5 to 12 no's before you get a commitment from someone to start referring to you. So let's talk about rejections. Look, in this industry, if you do not like rejections, well, that's going to make you more normal than abnormal. Look, I have never ever met any home health marketer, any business person that has started a business in the healthcare industry who loves rejections. All right? There's no such a thing as a person who loves rejections. And if there is a person, that person's sick in the head. Look, we are going to face rejections. Now look, if you think you can avoid rejection, then you know what? Congratulations. But honestly, there is no such thing as any person who can avoid any objections. It's all over here. It's all over us. It's all around us. If there is something that you want and you ask someone to help you with it, and then all of a sudden that person declines, then you just experienced rejection. You asked your kids to behave in church and stay quiet, and here they are, just keep on blabbing out. That's rejection. All right? Look, by you just literally going out there and asking for referrals and people not giving you referrals, you are being rejected. You just have your agency license now. You are in Medicare.gov. You are listed in your local, health department. You're located in the internet. You're located in the yellow pages. Somebody browsed through the yellow pages, saw your name, but picked the other company. Well, you have just been rejected. The experience of rejection is an emotion. What you need to do is that when you get rejected or when you get that experience of a rejection is to start looking into things to figure out why you got rejected. Don't put yourself in a position where you feel that you're a victim, that there are other reasons, or you start creating the reasons even though you never really heard it from the person. Look, we are going to make excuses why we are not successful. It's a lot easier to make an excuse rather than to look into it and judge ourselves and self-critique ourselves what maybe we could have done to become successful. Ask yourself, why have you been rejected in the past to get patients? Did you follow the patient enough? Did you follow the referral source enough? There are more reasons why you did not become successful, and most likely it's because you were not able to create any action. So the question you need to ask yourself if you do face an initial rejection is, how could you be more effective? How could you turn this referral source, turn this social worker around and have them start sending you patients? No one says to you, I am rejecting you. They are merely telling you that they are not doing anything for you through not saying anything or not creating any actions. Look, rejection is experienced by those who are unwilling to be responsible for the outcome. Just because you get a rejection, just because all of a sudden somebody tells you that we're not referring patients to you, or just because somebody says we are going to start using your company, but a month later and nobody is referring patients to you, look, those are all little samples of rejections that you're going to face, or literally tell you we don't have time for you right now. Look, what you need to do is to be able to ask yourself, what can I do better? what can I do to be more effective to make sure that next time I'm able to get a hold of the person I want to speak to? And just because you got rejected by this one person, there are other multiple actions that we can show you here at Home Health Success Academy on how to be able to break past those barriers, to break past those objections. Look, in marketing, in sales, it is an amazing thing to be able to be rejected. Why? You just learned one thing of what you cannot do to get that person's business. Now you need to try something different. Now you need to try a different strategy. Look, that's why in healthcare, in home health marketing, we will provide you with so many different actions to be able to target a particular person, because each person is an individual, and sometimes you need to be able to customize your marketing strategy in order to get in the door. Look, you know that you qualified that physician that they have patients. You know that hospital actually has patients they refer to home health services. You know that nursing home is discharging patients 5 times a week. So you know they have patients. So if you are not getting the patients, obviously someone else is doing it. So you need to be able to not look at rejection as a negative thing, as a setback. It is a learning experience. So you as an owner of a home health agency, you as an administrator, when your marketing team, when your sales team, when your nursing liaison comes back and gives you an excuse that they got rejected, you ask them, what is your next action to get that person to refer to you? Don't let them just put their tails behind their back and just tuck it in. No, don't do that. You need to be able to ask them the question. So what are your plans next? What do you think is going to work for this doctor? What do you need from me to be able to help you to strategize yourself next time? Look, you already made a point of contact. That's 1 down. Now you have maybe, 1 to 9 more no's or rejections to go in order to start getting those referrals. The one who's persistent and the one who is positive will get those referrals.